Welcome to St. Louis on the Air. I'm Don Mars. Today we're getting details on a very much 21st century program at Washington University. It's a risk assessment training project called At Risk, using virtual reality to help staffers recognize signs of anxiety, depression, and potential suicide among students. Joining me to take a closer look at this project are Jordan Worthington, Assistant Director for Mental Health Outreach and Programming at Washington University. She was partially responsible for the initiation of this program. Dr. Cherie LeBlanc is Executive Director of the Hobbit Health and Wellness Center at Washington University. And Glenn Albright is Director of Research at Kognito, the health simulation company responsible for At Risk. He joins us by phone. Thank you all so much for being here. Good to have you.
Thank you.
Jordan, let me begin with you. Can you give me kind of an overview of the need for a program like this at WashU?
Sure. Well, we've found that today, I think it's no secret that awareness and demand for mental health services on college campuses is growing. And so we wanted to find a way to, bearing in mind that we know that a lot of students who are experiencing emotional distress might not seek help, we want to find a way to widen the safety net for those students. So they might not feel comfortable going to a mental health care provider based on whatever situation they might be coming into college with, but they might feel more comfortable talking to a faculty member or a staff member, someone that has more day-to-day interactions with them. So we wanted to make sure that we found a way for the people in those roles to feel confident and comfortable having tough conversations with students.
Cherie, why is this an issue that seems to be growing? Do you have any sense of that?
Sure. I wish there was a simple answer to that, Don. I think it's really a multifactorial concern. I think overall what we've seen is in a decrease in the stigma of mental health. So more students are feeling comfortable coming forward and asking for help with their mental health concerns. We're seeing more students now, because mental health has been, just the advances in treatment, students that may not have been even aware or being able to start in college because of their mental health concerns, because they've gotten good treatment, are now at a point where they are certainly welcome and thriving on college campuses. But I also think there's been a lot of talk and a lot of studies that look at social media and what it's done to this particular generation, a decrease in people being able to have good social face-to-face interactions, people feeling in that generation, even though they're socially connected online, less connected. I think in a person-to-person relationship. And then we always kind of come back to, as a mother of 3 college-age students, let's blame the parents. But we look at, parenting and in such good-intentioned parents looking at making sure that they've been able to pave the way for their students to succeed. And students have had less chance to practice and hone resiliency skills. And so sometimes the everyday stressors that they face, they'll face for the first time in college. And it's very difficult for them to handle because they don't have that background of experience.
This whole issue of the social media interaction or lack thereof is worthy of a program or two all by itself.
Definitely is.
It's really making itself felt. How do you see it, Jordan?
I see it as, in one way, it's great for students to be able to connect with one another and maintain ties with friends who have gone off to different universities. But on the other side of that coin, we have this unhealthy sense of comparison that social media breeds. And I hear a lot of students talk about, we try and remind ourselves that our social media, our Instagram feed, because Facebook isn't cool anymore among college-age students, but our Instagram feed is just the highlight reel of our life. But it's really hard to remember that when you're scrolling through and it looks like everyone else is having an amazing time in college and they've made all these cool new friends. And are they cooler than the friends you had in high school? Am I as cool as them? Are the friends that I'm making, how do they compare to the friends of my friends from high school? And you forget that behind that one picture that someone has posted, there's probably 200 pictures that didn't make the cut. And you're not seeing when someone is stressed, when they're sleep deprived, when they're not taking care of themselves. And so we have the comparison. You forget that it's not real. Mm-hmm. It's very much manufactured.
That's one aspect of today's high-tech world. And Glenn Albright, you're working on another. Give us some sense of how this whole at-risk virtual reality thing works.
Well, the at-risk for faculty and staff really prepares faculty to have the skill and the self-confidence to be able to identify those students that were mentioned as being in stress or sleep-deprived or disheveled, those students that are experiencing a problem, and then to be able to create a safe enough environment where they can engage in a conversation with that student using evidence-based communication strategies to be able to determine what the problem is, and then to be able to motivate them to seek help. Now, this is really accomplished by placing the faculty or staff member in a virtual environment where they actually role play with virtual students that are coded with emotions and memory and personality, and they'll react like a real student in psychological distress. So it's by practicing these role plays and receiving feedback from a virtual coach along the way that faculty and staff, they really learn the skill, the knowledge, and the self-confidence to have these, what can be really difficult conversations with students in real life. That's the way the program, in a nutshell, operates.
When I think of virtual reality, I think of someone wearing a headset and goggles and what have you. What are these people seeing when they're going through this process?
Well, they're assuming the role of an avatar, and then they're actually speaking to a virtual human, in this case a virtual student, who has all the nuances, the language, the behavior of a real human being, in this case a student in psychological distress. The environment is representative of the actual environment where these conversations will take place. For example, the faculty member's office. And the entire conversation is crafted by really getting the knowledge of nationally renowned subject matter experts and beta testing it with hundreds of end users to be able to really create a very realistic virtual environment and a simulation that allows them to gain the knowledge and skill to have these difficult conversations.
So I just want to be absolutely clear on this. We're talking about an avatar, a virtual reality situation that does not involve an actual student who might have a mental issue.
No, it doesn't involve a real student that has a mental issue, but it involves a computer-generated online virtual student that offers you the opportunity to try various communication tactics first of all, to make that student feel comfortable in opening up, to create a safe environment, and actually gives you practice at using various techniques to be able to elicit the problem and to make a referral to the counseling center. It is really very, very unique type of simulation technology that's driven by a game engine that allows users to gain exactly the skill they need to be effective, what we call gatekeepers in higher education.
Right. Cherie LeBlanc, does it work?
I think so. We've certainly had some very good feedback from faculty and staff that have taken it. And honestly, I think that this particular format is really promising because we've tried a few other programs over the years at Washington University. It's hard to get folks, to come to a training that's an all-day training on one specific day. This allows faculty and staff, honestly, to access this at any time on their own time. They can practice before a potential meeting. So again, it's that real hands-on skill, and we've certainly had good feedback. It's a evidence-based program, and certainly I think Glenn can speak more to the research behind it. But I think it's been a wonderful addition to our campus.
Jordan, you've had some 250 test runs, I guess we might call them, on
yes.
this. What is your take on what you've seen in terms of results?
In terms of results, well, we've launched the program in early September, so we're about 6 weeks in. So I think it's hard to say anything definitive.
Has it been implemented with any actual students?
Well, I think some faculty members have told us that it's helped them feel more confident in interacting with students. And we're just getting to that point in this semester where it's midterm season and some of the signs of real intense stress are starting to show. So this is about the time in this semester where we would say that the rubber hits the road with these skills. But we find that the people who did take part in the simulation really appreciate that they learned new skills, or it maybe clarified their thinking and what techniques they were already using in interacting with students who were experiencing distress. And we also found that one of the things they appreciated most was that these are hard conversations to have, and sometimes you think, oh, well, it would be really great if I had more training in mental health, or like if I was a therapist, I'd be better at having these conversations. But the great thing about this program is you don't have to be a therapist to have these conversations. You just need to know these basic skills that Glenn mentioned, and to be able to use them and know when to know when your expertise ends and you need to refer out.
Cherie, who initiates these conversations?
I believe during the simulation, the simulation is a meeting between a student and the faculty member. I think the faculty member might have brought the person in, the student in, just to have a meeting. And so usually it starts with the faculty member saying, thanks for coming in. I wanted to talk to you about X, Y, Z. And they can choose kind of how to even start that conversation and what path they go down.
So if an instructor sees a student that he or she suspects might have a problem, they can call that student in, take advantage of what they have learned through this simulated training to maybe get a better handle on the student.
Yeah, or it might be that a student has reached out to a professor because they're experiencing a lot of stress, and this could be a good time for a professor to have that conversation with a student.
Then what? You have the conversation and the training indicates that there may be a problem with this youngster. Then what happens?
At the end of the simulation, faculty and staff members of WashU are provided a resource list, and so they know what resources are available and how to provide information to the student to be able to make an appointment with our mental health services.
I would think there'd be some occasions, perhaps, where the students might actually resent this kind of involvement. Cherie, you're nodding.
Yeah, well, I think, and it's what I like about this particular training too, because I feel the students are pretty realistic, and I think Glenn can also speak to this, in that they are going to come across with some resistance. And in fact, that's part of the training. And how do you respond to that? And then what do you do? I think, honestly, when we look at the statistics of suicidality on campus, and when we look at risk, many of these students have never set foot in the mental health services. And so the whole purpose of this particular type of training is really to allow those people who the student may be interacting much more frequently with to recognize that there may be, and just to approach them in a way that actually takes down some of that resistance, allows them to relax, kind of open up. And it may not be the first time. It may be, a follow-up meeting. It may be another time, but it allows more people on our campus to just be aware of how to approach a student and hopefully get them the help that they need.
Glenn, coming back to you with regard to how this all evolved, who writes the programs, for instance, and how did you get into this?
Okay, so in terms of where it evolved, many, many, many years ago, out of the Virginia Tech event that occurred where a number of students were murdered, and all the evidence showing that they missed an opportunity or several opportunities to intervene. And we know that faculty members are incredibly able to provide gatekeeping skills but about 60% say that they are totally unprepared. And we find that 95% want to assume the role. So there was a definite need for the program. And the use of virtual characters is a superb way of making the training available and effective, because when you and I start interacting with a virtual character, we're less likely to feel judged, we're more likely to open up, and being that you have to role play these conversations to get really good at it with students, when you're virtual role playing, there's less social evaluative threat. That means you are reducing the anxiety that people normally feel when they're learning by role plays in front of peers or instructors. That reduced anxiety results in a reduction in what we refer to as cognitive load, which kind of frees you up to drive the learning home. So in terms of actually authoring these simulations, there are dozens of instructional designers, animators, people that are in coding, subject matter experts, and of course the end users all give you feedback. It begins with a very comprehensive and iterative needs analysis to define the problem, to look at the intrinsic motivation to get the learners to stay involved and be involved, to examine all the factors that inhibit learning and then account for them. So this simulation, it takes a good 4 to 6 months to really to be developed and launched, and to be followed by a rather comprehensive evaluation.
What have you learned in the time you've been doing this about the effectiveness of this whole process?
Oh, it's unbelievable. I mean, the simulation that we're talking about now, we have a sample size of over 40,000 people, and when you look at behavior change that you mentioned a little while ago, in the 3-month follow-up, we see significant increases in the number of students that were identified as in psychological distress, number of students that were approached and talked to, and a significant increase in the number of students that were referred to the counseling center or support services. It's incredibly effective.
Jordan, I wonder if there isn't a liability issue in the midst of all of this. Perhaps I'll call it a diagnosis. It's not that, but if an instructor sees something, and really what we're talking about here is just a normal kind of stress that college students would experience that would be average, let's say. Isn't there a danger that an overture could be made on the part of the instructor that the student would resent and then perhaps take legal action?
That's a good question. That is, and Glenn, if you have examples from other universities, I welcome them. I would say that one of the good things about the program is that it definitely de-emphasizes any need to diagnose, and that's not a part of the training at all. It's just, I noticed that you seem really stressed, and sometimes I know that it's useful for other students to talk to someone about this or to seek care. And so it doesn't train people who take the program to make such leaps as to say, it looks like you have anxiety or it looks like you have depression, and just encourage people to seek help. And I would hope that wouldn't be a need for being litigious. I think the one instance is that if the instructor or staff member notices that there is some suicidal ideation in the student, or they disclose that, I think ethically and legally someone, or I'm not sure about legally, but ethically someone should be mandated to make sure that person seeks care immediately. So we would, I suppose, rather err on the side of caution and make sure that lives are being saved rather than the opposite.
Cherie, you have any thoughts on that?
Mm-hmm. I think it's an interesting question. For the most part, this is really the program itself is really made to encourage students to seek help. It's not it's not a you must go because otherwise I'm not going to give you an A on your test, or in that way, it really is more looking at something to be a resource, and the student could take it or leave it. It's really their choice. I think you're right when it gets to be. It gets a little more tricky, and then I don't know that really would have come up, and Glenn may be able to speak to that, whether there have been cases of acute suicidality and feeling that in that way mandating someone to seek care and at least be safe. But it's an interesting question. I guess we'll see where it goes.
Glenn, can you address that, please, in about a minute?
Absolutely. I mean, between the 1 million plus users that have completed the K-12 and higher ed simulations, there's never been a case that we're aware of where that has occurred. And in part, it's because the learning model really emphasizes the use of motivational interviewing strategies, which is a type of evidence-based communication strategy that it involves just asking open questions and summarizing what's being said to you by the student, and part of it involves emotional regulation, empathy, and you're really providing a safe environment for the student to feel comfortable opening up. You do not diagnose. You do not judge. You just allow the student to be able to share what's going on in their life so you can help them. And then to make a type of warm handoff, a warm referral. And I almost think that it would be negligent not to have this training if you have a student who is potentially depressed or suicidal or experiencing a high degree of anxiety.
Let me stop you there. I'm afraid I have to interrupt because our time is up. Fascinating stuff. It's 21st century stuff. Thank you all so much for being with us. Jordan Worthington, Cherie LeBlanc, and Glenn Albright. Thank you.
Thanks, Don.